Good evening, and welcome to this Facebook Live here on blackdoctor.org. I am Ellis Dean, the Director of Programming here at blackdoctor.org, and we have our monthly Seeing Eye to Eye Vision Health Series. So this is in partnership with the Children's Vision Equity Alliance, as well as the National Eye Institute and there's somebody else I'm missing, but I apologize for that. But yeah, the National Eye Institute and the Children's CVEA do a great job of putting together this programming on a monthly basis, bringing you the top specialists to talk about all things eye related. So tonight we have the title is, it's got so many letters I couldn't even put it on screen. We have a neuro-ophthalmologist here tonight. So we're going to be talking about concussions and head trauma, and particularly in childhood, because we know parents are out there. We're worried school's about to get back in, so we already know football camps are getting back into play. And we know when we have sports that are contact or collision sports like football and baseball and basketball and soccer and all these other sports, head injuries follow. And so we're going to be talking about how those head injuries impact the vision. And that's why we have a neuro-ophthalmologist here with us this evening to talk about that. And so a couple of things before we get started, I'm going to introduce our guest for you. Number one, I want you to let us know where you're watching from. So drop that in the comments. We'd like to know where people are watching us from all over the world. So please drop that in to the comment section. Number two, if you know somebody that needs this information, particularly a parent that has a child that's playing sports or will be playing sports, please tag them or share this on their page so that they can get this much needed health related information. And number three, if you have any questions throughout tonight's broadcast, please also drop those in the comment section and let us know, because we'll get those questions asked and answered here tonight, because this show is all about you. So all right, now let me tell you who our guest is. Okay, so we have Dr. Adeshina. I have to say that I've got that Southern tongue, so I have to make sure I have it properly pronounced. He is a board certified ophthalmology trained neuro-ophthalmologist with additional training in oculoplastics and orbit. Okay, he is currently an associate professor of ophthalmology and clinical associate professor of neurology at McGovern Medical School, and had been with the Robert Cizik Eye Clinic and Ruiz Department of Ophthalmology and Visual Science at UT Health since December of 2013. He has a number of that. You can see I'm stumbling over that because all of the big fancy words. But let me tell you something. The brother is bad, brother is smart, and brother is here to give you what you need to know tonight. So just hang out with us and let me introduce to you Dr. Adeshina.
Introduction. Glad to be here. Thank you for inviting me, and looking forward to our discussion.
Absolutely. Like I told you when we were talking before the show, I am excited because as a parent, as a child that plays sports and still continues to play sports, he runs track, plays baseball, and for many years he played football. And every game we were, when those big hits happen, and we've had friends, kids get concussed. Thankfully, he hasn't had that problem, but we've seen it happen, and it's not a pretty sight. And so I guess the first question is, what are those activities? If we know it's football, right? So we know football is a big one, but what are those other activities and sports that are at particular risk for a concussion?
Yeah, so particularly in kids, we talk about kids and maybe a little bit about adults and older adults as well, but there's some overlap between the age groups. But for kids, like you said, contact sports like football are higher risk for concussions. Soccer, hockey, basketball, all those sports, because of the collisions, maybe falls or impacts with other players, can produce a risk of concussion. In addition, just simply playing on the playground equipment, falling down while doing that, riding a bicycle, sports like gymnastics, karate, those also can put kids at risk for concussions. In adults, again, there's some overlap: football, soccer, also rugby, boxing, martial arts. The rise of mixed martial arts, MMA. You can have the risk of head injuries and concussions with that. And in older adults and people who are older age, falls of any kind are a high risk for concussions. In addition to activities like cycling, horseback riding, and skiing. Again, if you fall doing those things and hit your head, you can be at risk for a concussion.
Okay, yeah. So I'm thinking about like car accidents. That anytime that head, I can get jostled and things like that. So, all right. So just for our own edification, help us define concussion for us, and then is it something? And help us kind of delineate: is it immediate? Will we see those big hits like we see in sports, or is it something that can be cumulative?
Yeah, good question. So a concussion is a type of traumatic brain injury. It's caused by a blow, a bump, a jolt to the head or body that causes the head to be shaken. And when that happens, it can do damage to nerves, the axons of nerves in the brain, which is the long process that help the nerves connect and talk to each other. Those carry signals between nerves in the brain, and when those nerves are injured, it can cause a temporary disruption of normal brain function, leading to symptoms that we'll be talking about here in a little bit. Uh, Cumulative injuries occur when a person experiences multiple concussions over time, and each subsequent concussion, especially if it occurs before the brain has fully recovered from the last one, can be more severe and lead to longer times with symptoms and longer recovery times. Uh, Multiple concussions over time increases the risk of long-term problems, such as something called chronic traumatic encephalopathy, or CTE, which I think we've heard about a lot, especially with the NFL in the past few years. This is a neurologic disease associated with repeated head injuries. Symptoms of that include memory loss, confusion, impaired judgment and impulse control problems, aggression, depression and anxiety, and even lead to progressive dementia. We've seen in some cases some NFL players who develop severe depression from their CTE have also committed suicide. So it's a serious issue. And these symptoms often begin years or even decades after the last brain trauma or end of athletic involvement. So while you may experience a concussion from a big hit immediately, the cumulative effects of hits to the head over time that may not even cause a concussion can lead to long-term, we call sequelae, or symptoms or problems down the line.
It's interesting, and it's kind of a sad aside story. A few years ago, I would say now, many years ago, these years are running together. But I happened to be I was in Miami, I was in South Beach, and ran into Junior Seau.
Wow.
And a really, really nice guy. We were at the same, kind of restaurant there on the beach, and we had a chance to have a conversation. And really, really nice guy, friendly, affable. And then a few years later, he took his own life. And so, and he was specific about in the way he did it, because he wanted to have he wanted to preserve his brain.
Yeah.
And have a study for CTE. And we know all of the kind of the fallout from the CTE studies and the whistleblower and with the NFL and the money that they had to pay as a result of players and kind of hiding the years of concussions that can happen. And so it's a sad story, it's a sad tale, but it's a cautionary tale that we have to be cognizant of. Speaking of which, now you've helped us understand what concussions are. What are the symptoms? What should we be looking for if we've had either we've hit our head, fallen, or had a severe kind of jostling? What kind of symptoms should we be looking for?
Yeah, another good question, another important question. And then again, this may not happen immediately after the head injury or blow or jolt that's suffered. It may be slightly delayed, maybe a day or two, maybe even a week sometimes. But symptoms can vary from person to person, but they commonly include headaches. Probably the most common symptom is headache, dizziness or balance problems, nausea, vomiting, fatigue or drowsiness, confusion or feeling mentally foggy can also be symptoms of concussion, which includes memory problems as well. Light sensitivity, noise sensitivity, that's out of proportion to what you may normally experience.
Mm-hmm.
Irritability or mood changes, sleep disturbances. So if you have insomnia now, you can't sleep, you can't get enough sleep, is an issue. And then vision changes. Obviously, we'll talk more about that in a little bit, but vision changes, blurry vision, difficulty focusing can be symptoms of a concussion. If you suspect a concussion, it's really important to seek medical attention. A concussion diagnosis is typically made based on a thorough evaluation of symptoms, medical history, physical examination, and neurologic tests. So you can suspect one based on the symptoms, but it's good to get checked out so somebody can talk to you and do an examination that would confirm the diagnosis.
So I guess I'm just curious. Is like should and I know in some sports they do like that baseline
Mhm.
where they that kind of neurological get a baseline, and then if you've had some sort of injury, then they'll come back and they'll test you against that baseline to see if there are some neurological deficiencies.
Right.
Um, is that something? Well, it's hard to do that if you're just a regular person driving a car or whatever. So,
Yeah.
um,
But that's why it's important as a parent. You know your child,
mhm,
right? You know how they normally behave. You know how they normally act. You know when they want to eat. I mean, my kids want to eat all the time, right? If they start coming and there's something's happened and they've had maybe a fall and they bump something, and all of a sudden they're tired all the time and they don't want to eat. Like for me, that's my kids. That's not normal. So
right.
that would make me think, maybe something's going on. Maybe we need to get something checked out. So even if you don't do a baseline official test of cognitive function, of neurologic function,
Right.
you may be able to tell just from knowing your child and the normal pattern of behaviors and sleep cycles that something is not quite right. And that would be your sign to maybe get them checked out.
Okay. So now we've got what is a concussion? What are the symptoms? Now, you are a neuro-ophthalmologist, so
Yes.
you've got your kind of your hands in you're playing in both fields, right? So you got ophthalmology and neurology. How does a concussion affect the vision specifically, and then in children particularly when we're talking about head injuries?
Yeah, good question again. A concussion can affect vision in various ways, and parents should watch out for some of the following related symptoms in a child with a concussion. That includes blurred vision, problems focusing, hazy or unclear vision, double vision, that's seeing two things instead of one, which can affect the ability to judge depth perception,
Mhm.
sensitivity to light. Bright lights can cause discomfort or pain. Your child might want to be in a dimmer light conditions. If it's you coming, out of the bedroom to the kitchen, oh, it's too bright, I need to go back to my room where it's dark and be more comfortable. That could be a sign of a concussion. Sensitivity to noise, which can actually exacerbate or make your vision symptoms worse. Eye tracking problems, which can be due to injury to the nerves that move the eyes or the parts of the brain that help coordinate eye movements, which can also lead to the blurred vision and double vision that they're experiencing. Visual field defects, like missing parts of the peripheral vision, can happen if there's significant injury to the part of the brain that helps process vision. Eye fatigue, eye strain, vision processing issues as well, just from the inability to track and focus the vision. These issues can result in difficulty reading, using screens, and it can affect school performance. So if you child's had a head injury, maybe not complaining specifically about a vision problem, but you're noticing maybe the school performance isn't quite up to par, or having trouble watching TV, using computer screen, that could indicate a vision problem that might be related to the head injury that they suffered, and prompt further evaluation and further investigation to what's going on.
And I would say as a parent of two kids and some of this kind of worked in mental health is that um, if your child starts avoiding certain things, right, I think that's a sign
Yeah,
that something is off. And so if they're avoiding activities like watching television, if your child used to like to watch television, all of a sudden that has gone down. You go into their room and they just got that one little lamp on in the corner. They've kind of reduced the light. They're not playing their video games like they used to. That avoiding behavior is always a sign that something's right because they're avoiding something that is bothering them, whether it's mentally or physically bothering them. If they have a stomach ache, they might avoid eating as well because they could be constipated. So any type of avoiding behavior is a telltale sign for parents to watch out for, particularly when they've had an event, right? And so that's what the next question is, because like I was thinking as you were talking about those symptoms, I was like some of those symptoms mirror migraines, right? In
right.
terms of some of the symptomology, but concussions has some sort of event that is either shaking or impact to the head.
No, that's a really good point. And in fact, migraine worsening, what we call exacerbation of migraines or
Mhm.
triggering of migraines, and people that actually have maybe an underlying susceptibility to getting migraines can be triggered by a head injury. Post-traumatic or post-concussion syndrome, uh, one of the main symptoms, like we're talking about, is headache, and that headache can have very, very strong migraine features, sensitivity to light, sounds, nausea, vomiting, dizziness, and in fact, management of post-concussive syndrome in any age group is geared significantly at mitigating or reducing headache symptoms and complications that come from that, and treated in many cases just like you would treat a migraine.
Yeah, no, that's all right. Kind of derailed us from our path.
Oh, that was a great question. That was a great comment. It's important to say that headache symptoms, headache syndromes have overlap.
Yeah.
And just because it acts one way doesn't necessarily mean it's just that thing.
Yeah.
To kind of connect the dots, like you said, based on the initiating or inciting event, something happened. So we take that and then what's going on after it to put the dots together and help make a diagnosis.
So parents, when you take your child to the doctor, if they're complaining of headaches and vision blurriness and things like that nature, when the doctor asks, was there a precipitating event? Did they hit their head? They're checking because they're trying to delineate between, is it concussive or is there something else? And so they're just going through their decision tree so they can get to the point where they can be more helpful. So don't get frustrated, okay? They're going to ask you a whole lot of questions, and you're like, well, I told them that. Like, no, I'm going to ask you again because they want to make sure that they're diagnosing it properly and they can get you the right treatment, because wrong diagnosis can impact the treatment and prolong it, and your child could be suffering those symptoms if they don't get those questions. So please answer as fully and as completely and as honestly as you can so we can get to the right conclusion. So, Doc, I want to know, all right, so how long do these symptoms last? I mean, because we're talking about these symptoms and they don't sound very pleasant. I mean, headaches and vision problems and sensitivity to light and all these different things. None of that sounds good. So how long can someone expect, particularly a child, because, children, they can complain a little bit more. And as parents, we want our children to feel as healthy as possible. Yeah. So how long will they last? And, I know an aspirin is not going to just help them get through it.
Yeah. So the duration of a concussion and the symptoms can vary from person to person, just based on the individual, also based on how severe the head injury is. Okay. Mm-hmm. Most individuals will experience symptom improvement or resolution. It'll go away within a few days, maybe a few weeks. But again, others can have symptoms that persist for several months, even longer. When your symptoms persist for longer than a few days, maybe up to a few weeks, it's important to consult with a healthcare professional. And typically for a child, that would include seeing a pediatrician. You've seen them before. They would know your child better than somebody they've never seen them before. And from that first stopping point, seeing a pediatrician, they can then refer to somebody else who may be more specialized in the specific symptoms that a child is having, whether it be a neurologist, an ophthalmologist like myself, somebody in sports medicine or pediatric rehabilitation that has experience in helping children with head injuries and concussions. These individuals can provide appropriate guidance and interventions to help alleviate symptoms and then monitor progress over time and see if the child is getting better or not, or recommend specific testing, maybe brain imaging to make sure there's nothing else structurally going on in the brain, like a fracture or a bleeding or something else that would be causing prolonged symptoms. And it's important to follow up with healthcare professionals who are experienced in managing concussions, like we said, to monitor progress and address, ongoing, more long-term symptoms. So I think I answered your question.
You did. I was just I was thinking in my head, like in terms of that kind of pathway of who they go see. So like child has an event, let's say that they're playing a sport, they get hit in the head, severe head injury on the sport. The typical first spot is either going to be an emergency room or some sort of urgent care facility. Then they'll may go to their pediatrician as soon as they can get into the pediatrician. And then if they get referred out, is that based on the symptom kind of that the child is reporting? So if they're reporting more vision impairment, then they would go to you, a neuro-ophthalmologist. But if they're reporting more like headaches and then they would refer them to a neurologist. How does that play out as they start to follow down that path?
Yeah, good question. So, initially milder symptoms of concussion, dizziness, mild headache, feeling slightly off balance. Again, those can resolve fairly quickly. Again, if they persist, or if more severe symptoms start to develop, we call them red flag symptoms. So again, changes of behavior, confusion, problems, speaking, problems staying awake, loss of consciousness, okay, uneven or unequal pupils, vomiting, seizures, weakness in your extremities. Okay, that's go to the ER. That's don't wait to go to the pediatrician on Monday. That's if it happened on Saturday, go to the ER on Saturday, right?
Right.
Because again, you want to make sure you're not having a brain bleed or more severe injury. It needs immediate medical attention and intervention. Um, for longer term follow up, again, I think seeing a pediatrician is the best first place to go. And your symptoms are predominantly headache, dizziness, cognitive issues, then seeing a neurologist would be the next logical, I think, step for referral. If you have vision issues, blurry vision, double vision, problems focusing, uh, honestly, typically a neurologist then will refer to either pediatric neuro-ophthalmologist or pediatric or a neuro-ophthalmologist for evaluation to get a detailed eye examination of the eye movements, of the visual acuity, of the visual fields, and make sure that the ability to track, the ability to converge, which is bring the eyes in together to see up close. And one of the things that happen with traumatic brain injury and concussions is what's called convergence insufficiency. So convergence is bringing the eyes together to be able to see up close and focus. And that's very commonly injured in concussion. Be addressed either with time. Usually time makes it better. But if time doesn't make it better, you may need to update prescription for glasses. You may need to do exercises to help the eyes strengthen the ability to see up close, or maybe even prism and glasses to help the eyes be able to focus up close better. But the decision tree tends to start with a pediatrician and then branch based on what the longer term needs and symptoms of the patient is.
Okay, wow, this is great stuff. So, guys, I'm going to remind you I told you at the top of the program, if you have any questions, please drop that in the comments. We'll get those questions asked and answered. And if you're used to watching this program that we do on a monthly basis, and you're used to seeing at least two ophthalmologists, we want to send out our thoughts and prayers to Dr. Mitchell and her family. They experienced an event that she could not make it with us here tonight. So but we're in good hands right now because you can see brothers handling all these questions. All right. So, and even something we didn't even send them. So we have this coming out to come here. So, all right. So how do concussions? So if, let's say in those instances where one or two things could happen. One, the child is not reporting symptoms, or the parent is kind of downplaying them. They got hit in the head and they're kind of downplaying, oh, don't worry about it, just go lay down, you'll be fine. What happens if their child if their concussion is not treated effectively what happens over time if their concussion is not treated?
So if a concussion becomes prolonged and symptoms become prolonged, from a visual standpoint, particularly, it'll make it difficult for a child to function. Really hard to read, hard to concentrate, engage in visually demanding tasks. And this will potentially lead to impaired academic performance, problems at school, whether it be cognitively with the actual academic performance or even behaviorally. So having issues with getting notes from teachers, the child's not paying attention, they're not doing their work. Okay, those are sort of red flags that something is going on, especially if the child's not telling you what's going on. They may have trouble participating in sports, physical activities that can affect their social interactions, hanging out with friends, even family members. Kids go to grandma's house and they don't want to hang out with grandma like they used to. That's another red flag.
Right.
If they don't resolve in time in the manner, they can again lead to what's called post-concussion syndrome, and that can lead to physical debilities, cognitive and emotional symptoms, and in extreme cases, in long term, it can lead to anxiety and depression. We don't want it to get there, obviously.
Right.
That's why picking these things up early. That requires, again, if a child is not telling you these things, try to pick them up from their behavior, from things that don't normally happen that are happening now.
Right.
For parents trying to downplay them, that requires the community around them, right? Grandparents, aunts, uncles, friends, to say, something's not quite right. Try to encourage the parent to say, something's not quite right. I think you need to take a closer look at this, think about what's going on. Maybe you need to get checked out and looked at. It may not be your child. It may be your friend's, your child's friend. It may be, again, a niece, a nephew. If you see change in their behavior and changes in their activities that aren't quite right, ask the question, has there been a head injury? What's happened recently that's maybe caused this change in their demeanor and their behavior, so they can get checked out and get evaluated.
Oh, that's great stuff. So guys, remember what we talked about earlier, avoiding behavior. So you got to watch that in your child. That's not a self-report. That's just an observation. What are they avoiding things? Is there dramatic kind of mood swings, right? And an over response,
Yep.
right? So
Exactly.
just you got to watch that. Now with teenagers, okay,
I'm not there yet. I'm gonna listen to you about that, because you're ahead of me on that front.
I got two of them. I'm trying to tell you, it's hard, but they haven't had the precipitating event. So I'm going to chalk this up to just hormones and just kick it in. I'm keeping an eye on it, but it's like when you say take out the trash and there's a whole meltdown, it's just
Exactly.
I'm like, well, maybe you're post-concussive. Maybe I'll be the one to give them the concussion and we keep acting out. But that notwithstanding, I think those are the type of things that we have to just really, really pay attention to, and the significant, dramatic changes, particularly if there is an event, even if they're in a car accident, car seat, if they're in a seatbelt, just that whipping effect of the head. And
That's a really good point, because we tend to associate concussions with banging your head, actually physically hitting your head on something,
right?
When it can be whiplash. Anything that sloshes the brain around, makes it hit on the inside of the skull, on the front or back of the skull, and causes that injury to the nerves. Remember, it's the injury to the nerves that causes the disruption in function and causes the concussion.
Right.
That can be the precipitating event, not necessarily falling and banging your head or hitting your head with the helmet in hockey or football. It could just be just a whiplash injury. That could be significant enough to cause the precipitating event. So it's a really good point. I'm glad you brought that up, because I don't want you to just, they didn't hit their head on anything. Well,
Right.
It doesn't mean they can't have a concussion, right?
Yeah, that whiplash, that whipping effect is really that sudden jolt. The brain can hit the front, or as Doc said, in the back, and then now you've got a problem. And those are the ones that are particularly dangerous, because we don't think, oh, they didn't get hit, it'll be okay. And that could be just as significant as getting a hit to the head. So we always have to be paying attention to that. So we're working in concert here, Doc. So we got it going on. All right. So again, if you have any questions, please drop that in. All right. So we kind of touched on this a little bit earlier, but I'm going to revisit it because I want people to really understand what's going on. So in terms of who should they consult? I heard you say, if it's severe symptoms, vomiting, this real severe symptoms in the moment, that they should go to the emergency room and then follow up with their pediatrician.
Yes.
If it's something that is less severe, but they are reporting some symptoms, maybe you could go to an urgent care or go to see their pediatrician, and then let their primary care physician kind of refer them out if they need more assistance. Is that the
Yeah, I think you know the paradigm pretty well. If it's acute, severe symptoms that you talked about, loss of consciousness, severe drowsiness, nausea, vomiting, seizures, convulsions, right? Do not pass go to the ER. Done, right? For milder symptoms, again, if they're predominantly behavioral, cognitive, headaches, there's nothing wrong with going to your pediatrician first, getting checked out, and then based on that evaluation, being referred to a specialist if need be. Okay. If the vision symptoms predominate from the beginning, if that's what's most bothering them from the beginning, there's really no problem with going straight to the eye doctor and saying, my kid is having trouble seeing, or they're not acting normally visually, right? And getting an eye examination there. And from that first stop, as maybe an optometrist or a ophthalmologist, you may then get referred to a neuro-ophthalmologist based on what's seen on the examination and any further evaluation that's felt to be necessary potentially.
So as part of your evaluation, again, I'm going off script, but I'm curious now. So it's like, as part of your examination, as I'm thinking about all the other programming that we had, we always talked about getting a dilated eye exam, right? That's a big thing. Now, as a neuro-ophthalmologist, do you do the dilation and as well like a head CT, or what happens on that side in terms of the brain?
Yeah, that's a good question. So as a neuro-ophthalmologist, we do a full comprehensive eye examination, Okay, that's from the when you walk in, I'm looking at you, you're seeing how you're walking and how you're talking and how everything looks just from the beginning.
Okay.
We check the visual acuity. That means how well you see with your best correction. We then check your glasses prescription to make sure that it's optimized. We check your pupils to make sure they're reacting and behaving normally. Because if there's an abnormal reaction from the pupil, that could be an optic nerve injury. It could mean a brain injury, and that your eye movements and your pupils are connected. So if there's any eye movement abnormalities, that could suggest an injury to the part of the brain that controls eye movements. If then we check your visual fields, your peripheral vision. We can do it by counting fingers in front of you and see if you can see them. If you have a big visual field defect, then that's going to show up on that test. Then we can do specialized testing in the visual field machine for the older patients that can do that. Obviously, little kids can't do that, but older kids, adolescents can do that. Check your eye movements very carefully. Okay, make sure you're tracking normally. Make sure there's no evidence of a nerve weakness or an injury. We check your alignment. Make sure your eyes are pointing in the same direction, because when you have double vision from a neurologic problem, your eyes aren't pointing in the same direction. You're getting one image from one eye, another image from another eye, and your brain can't make those images one.
Right.
That's why you're seeing double. So we check that. Check for any abnormal spontaneous eye movements called nystagmus. That's injury to the brain in the back of the brain where the eye movements are controlled. Look at the front of the eye. Look at the eye itself, the eye socket. Make sure there's nothing that suggests a fracture or a break of the eye socket. And then we look in the back of the eye. Like I said, dilated eye examination with the optic nerve and the retina. Make sure everything back there is good. If there are any suggestion of a fixed neurologic deficit, meaning an eye movement abnormality, a pupil abnormality, a fracture anywhere, that would then prompt us to get neuroimaging in the form of a CT scan, typically an MRI. MRI is the way to look at the brain in a detailed manner to look for maybe subtle changes or maybe non-subtle changes that could suggest more severe injury than just an axonal injury of the axons. We can't see injury of the axons, but if we see maybe a brain bleed or find something incidental, maybe something was there before.
Right.
God forbid there was a tumor there before, and then this head injury made whatever was causing worse. Maybe before you couldn't tell, but now you can tell because it's sort of unmasked this underlying issue. That's when we get the imaging and help us, guide further evaluation and therapy.
Wow. Okay. That's really good. But all right. So if they have sound sensitivity, they got to wait for that to dissipate before, because that MRI can be loud. I mean,
little kids usually, to get an MRI, you have to sedate them because it's a loud, long test. I had an MRI before. I could imagine being you're trying to get an MRI, but you have to make them sleepy or put them to sleep to get that MRI done. But I can
myself, I'm like, if I had sound sensitivity, I don't know about because I had the old way where it was just really, really loud, and they just give you those little, and then the new way where they now they give you headphones and try to play music to really muffle the sound, but it's still very loud and you can hear it. So if you had concussion or potential concussion, that sound sensitivity could be problematic in an MRI. But hey, they're with children, let's sedate them.
Yeah,
even better. Because that'll limit the movement too, because they got to stay. So you got to stay still.
Exactly, and to sedate a child, it's kind of a big deal. So you have to make sure that's really indicated necessary to do it. You want the right person to evaluate them to make that judgment call to get that done.
Absolutely. All right, so I'm going to ask the most loaded question of the night. Okay, how can we prevent concussions?
Prevent concussions. So it's important to understand that the first way to prevent a concussion is understanding that they can happen, right? You don't know what you don't know. It's a possibility from either whiplash injury or head trauma, direct hit to the head while playing sports or physical activities. And concussion prevention strategies involve both, observation and vigilance, recognizing symptoms, and then taking proactive measures when you do see them. Okay, so the first thing is educating children, adolescents, and adults about the signs and symptoms of concussion, like we're doing right now. This is really the first step in preventing concussions, is learning about it. And then reporting head injuries when they happen. So whether or not a child has a symptom, it's good to make sure that you report that, as a coach, as a caregiver, as somebody who's taking care of a child, make sure that if a head injury does happen, don't just poo-poo it if they're not having symptoms. Just say, oh, they're fine. Let somebody who can act on that knowledge know if that does happen. Okay. We promote the use of safety equipment. That includes helmets, obviously, in contact sports. Helmets when you're riding your bike, riding a scooter, riding or using skates outside, right? Eye
Mhm.
protection, mouthpieces, and ensuring that you're not just wearing them, but they fit correctly. Okay, so if you're wearing a helmet and it's all sloshing around in your head, it's not going to protect your head if it falls off when you have that rapid movement that causes the head injury, right? So making sure that what is used is appropriate for the situation. Encourage adherence to rules, regulations in sports, minimize unnecessary risks, and enforce the rules when they happen. When you're in them, like my son is 9. He plays soccer. We talked about this before we came on. The rules in his age group in soccer where he played in this last season was no heading the ball. Now, I know that's weird, soccer, no head the ball, but we know that the cumulative risk of head trauma over time can lead to issues. So in his age group, they weren't allowed to head the ball, and heading the ball resulted in a penalty. Place spot the ball, spotted the foul, and you kick the ball. Even penalty kicks sometimes. So when that rule is in place, follow that rule. It's there for a reason. Now, it might seem strange to those of us who grew up playing soccer and didn't have any issues that we know of, and it's not a rule that will continue on as you get more competitive and higher levels of soccer. But when little kids are playing soccer, that's a rule that's followed. Um, Playing football, hitting the right way, don't lower your head. Keep your head up so you don't have those kind of injuries playing football. So also want to implement proper techniques and training programs, again, to mitigate the risk of falls and impacts, teach kids to do things the right way so they don't get injured. And then you alluded to this before, but there are ways to implement pre-sports baseline neurocognitive testing, things like the SCAT3 test, and I don't feel like time to get into all the details, just the King-Diffig test, to establish a baseline reference point so that when something does happen, and it's not a matter of if sometimes, it's a matter of when. You play enough sports, you're out there enough, doing enough things will happen. So if you have a baseline, knowing what normal cognitive function is, normal eye movements are, normal reaction times are to certain prompts, certain things you're asked to do, there's a change in that from baseline that could suggest, a head injury that needs to be followed up on and looked at in further detail.
Yeah, they're actually getting better. And as we talked about before the show, I used to coach, and so one of the things they implemented in the league that my son and the kids were playing in, what they did was we had to have a safety coach.
Mm.
And that safety coach would get the baseline at the beginning of the season when we first started practicing, before we started having any type of contact. They would have to establish a baseline, and they would have a book and have every kid's baseline. He would pull them out of practice one at a time, establish a baseline, make the parents sign and and everybody knew what the baseline was. So just in case there was a head injury, we could judge them against that. And then we were doing that with 7 to 8 year old kids. And so it made everybody feel safer and better, so we could better evaluate in those moments. And so we've got to. So while I thought it was unusual that it's a penalty if you hit the ball, I understand that at 9, that repetitive heading, particularly with kids that are at a lower skill level than they are on the professional level, you can have some serious.
You can, because if you don't have the technique and you're just kind of all willy nilly, not knowing what you're doing, it can cause an issue. It's a good point.
Particularly if you got a kid that doesn't want to hit the ball and they want to do that high foot kick, and you're going down with the head and that foot's coming up, you can get kicked right in the head. And so I think it's great. Now, for those parents, because I felt this, so I'm going to speak on their behalf. For those parents that say, well, they didn't do that when I was growing up, let me help y'all understand this. The way science works is when you get new information,
Yep.
you change your behavior. Like, we can't judge everything about how it was when we grew up. When we grew up, I drank out of a water hose that sat in the hot sun. That probably wasn't a good thing to do. My children don't even understand it. They laugh at me when I tell them that. Like, oh, yeah, we used to drink out the hose. And it was cool. And we say, oh, we got some bacteria that probably helped us. You know, we spin it however we want to spin it, parents. But just promise you, just understand this, that you want your child to enjoy and get through playing sports as healthy and as safely as possible. We understand there's going to be some accidents, but don't get mad at these leagues for implementing rules that is for the safety of all the children, and it can't be judged by what we did in 1970, whatever, when we played sports. So getting new information, you got to change how you respond, and that's the way science works. So.
Yeah, I couldn't agree more. That was great. That was really great.
I said it for you, Doc, and I know. I was like, look, I'll say it. Look, parents, y'all got to calm down with that. It wasn't like that when I was a kid. You know, yeah, it wasn't, and thankfully, it's different now. Otherwise,
Yeah, we saw it was as we were kids, and we're seeing all these adults now and professionals now with CTE. I mean,
yes,
it didn't have to be that way, but we'll have more long-term data, as we move forward, and with the rules that are being implemented, how that affects the numbers and incidents of these things moving forward. But if you have knowledge, you have information, you gotta use it.
Absolutely, absolutely. Also, speaking of knowledge and information, if you're watching it, I just put a whole bunch of websites and information there in the comment section. So it's got resources for protective eyewear for kids, because we understand, yes, they should wear goggles, and it's not just for basketball. If they have any type of, you should be wearing goggles. For my dentist, you should be wearing some sort of oral, because that does prevent the head from jostling as much as well when you're wearing a mouth guard. So all of those protective devices that when we were younger, oh, that's not cool to wear, or we didn't have availability, put them on the kids. I promise you, because you only get one set of eyes, right?
Yep.
You only get one set. So let's make sure we do whatever we can to protect them. So there's a number of resources in there, thankfully, with our partners at the National Eye Institute, from their website, from their page. So please go there, click those links, get more information to follow up. And then there's also one for parents and teachers. And I tried to delineate them as much as possible, so you can click on the ones that are most applicable to you and your child. But definitely, protect the eyes. Notice, and Doc, I'm gonna give you the last word on this in terms of what you want people to take away with, but I'm just kind of summarize what we talked about today. Just the main points that we talked about is: number one, eye protection. Number two, notice changes in your child's behavior if they've had an event, right? Whether it is a sport-related event or another event like a car accident where they've had some severe whiplash or something like that. If they've had an event, notice if they're complaining of anything. Notice any changes in behavior, particularly if there's something severe like vomiting, sensitivity to light, dizziness, drowsiness, significant mood change, with the asterisk caveat for teenagers. All of those things come into play. Those symptoms, and then follow the decision tree, right? And then you have to and if you're in doubt, when in doubt, take them in.
Yeah.
Right? When in doubt, if you're like, oh, is that severe enough? If you have to ask that question, take them in. Right? Because it's better to know and not have a problem than to wait and have that problem become worse because we delayed a little too long. Right. So that's that. So Doc, we're going to give you the final word. I didn't see any questions coming in from the audience, but final word, what is your main, what do you want people to take home from this discussion that we've had today, which has been fantastic, but what do you want people to take home? If they don't remember anything, what do you want them to remember?
Yeah. I mean, you've said a lot of important things. I'll try to encapsulate them in a statement. Concussions can happen. Know that they can happen, know what they are, and know the signs of concussions. Okay. That's sort of the biggest overarching message. It's important to prioritize safety and well-being of children, try to mitigate or reduce the risk of concussions by using safety equipment, following the rules, regulations in sports, right techniques to, again, reduce the risk of collisions and falls and impacts during sporting activities. And then know that cumulative injuries can happen. If you have more than one injury, it's not just, that last one was gone and it's gone. The lingering effects can be there. And if you have more than one injury, it can cause an additive effect. And taking preventative measures, understanding the signs and symptoms, help mitigate the risks associated with concussions, and then promote healthier, outcomes in the long term.
Absolutely. And then I just have one more question popped into my head.
Mhm.
Um, if you've had a concussion, are you more susceptible to having another one?
Yes,
All right.
yes, most definitely.
All right.
The threshold for getting a concussion the next time is lower. So probably take a less of a severe injury, whether it be a jolt or a whiplash or a hit to the head, and it can be more severe
Mm,
when it happens next time. And again, it's an additive effect.
yeah.
Yeah.
So parents, be careful. Like when they've had that first one, if they want to go back and play, take the extra precautions.
Yeah.
If they have a second one and they're still a child, you might want to reconsider that sport. If it happens in a sport, you might want to reconsider that sport because you got to think about your child's long-term health versus that short-term gain. And I get it. My son was really good. He was really good at football, and we had all the videos. You go to my Facebook page, all the videos and all that stuff. And he said, "Hey, Dad, I don't want to play anymore."
Hmm.
And I was like, and it was okay. I had to be okay with it because, you know, he wasn't finding the same level of enjoyment. And I'm in the stands. I'm up there cheering. I'm not putting my body on the line. I'm not out there doing that stuff. I'm up there cheering, getting patted on the back. Dad, your son's so great. And parents, I understand the drug that can be
Mm.
watching your child compete. I understand that it's intoxicating as it is, but please, please, please take your child's health and safety. Put that first when it comes to sports, and they will appreciate it later on. You know, maybe not but they will appreciate the fact that you put their health and safety first over your enjoyment of watching them play those sports. So
Definitely.
that's my PSA. So thank you again. This has been a fun conversation, really, really interesting and enlightening. Parents, please check out those resources. Get as much information as you can going into before. It's better to get it beforehand than try to do a crash course in concussions after your child's had one.
Exactly.
So that's what this program is for. That's what the resource is for. I'm going to thank our partners again at the Children's Vision and Equity Alliance, as well as at the National Eye Institute, for helping us put together these programs for you. We're looking forward to next month. I've already got the doctors already lined up and ready to go, so we're good to go. So thank you all for joining us. Like and share this program, and we'll see you in August again. And I think August is like a special month. It's like child vision health is, I think, something is big for August. So we're going to figure it out. We're going to go big in August, and we'll see y'all next time here. Thank you all for watching.
Thank you very much.